Wonderful to be talking to you from the Redcliffe Kite Fest. An event like this could not be held in any other state or territory on the east coast mainland of Australia right now. We are the only state open across the east coast, and we can hold events like this because Queenslanders have done the right thing. They've done what we've asked of them. They've come out and got tested whenever they've had symptoms. They've been wearing masks and they're getting vaccinated. We say thank you. To all those families who are now gone back into quarantine because of the most recent cluster, we say thank you for the sacrifice you're making, and we will do everything to support these families associated with the school and other close contacts, because we know how important it is that they quarantine to keep everyone safe. It is great news that it's a double donut day. I have just bought a couple of donuts here at the Kite Fest to enjoy. We had great results yesterday, and I just want to talk about our amazing testing results for Saturday. We had 18,069 vaccinations yesterday and 12,415 tests. So thank you for over 18,000 people coming forward to get vaccinated. That is a great result. We're hoping for another big day today. In fact, we're trialling vaccination at the NRL game at Rockhampton today. So let's see how many footy fans come forward and get vaccinated. Today also we're announcing that we are mandating vaccinations for all of our health workers that work in our hospitals and all of our Queensland Ambulance Service staff. Now, already our health workers have done a tremendous job coming forward and getting vaccinated. In fact, 80% of our entire health workforce, so admin, our clerical, our security, our cleaners, our nurses, our doctors, have already had one dose, and 73% of our entire workforce is fully vaccinated, 73%. Across our COVID hospitals, 79% are already fully vaccinated and 84% have had one dose. But we know we need to go even further. So from today, we are mandating it, and everyone will have to have had their first dose by the end of this month, 30th September, and be fully vaccinated by the end of October. Now, I know that's only 3 weeks away to ensure everyone's had their first dose, but we're confident we can get there because the majority of our workforce is already vaccinated. We've worked with the unions. We have support across the board. We will work with those staff who cannot or will not get vaccinated to find alternative arrangements and work through those arrangements with them. But it is important that we keep our health staff safe, and of course it's important that we keep our community safe and those patients and visitors who come into our hospitals. We have seen a lot of transmission of the virus in hospitals through New South Wales, and sadly we have seen a lot of deaths associated with those hospital transmissions. So we do need to make sure that we're doing everything we can to lower the risk. Again, it's wonderful to be here. I want to acknowledge the Moreton Bay Region Industry and Tourism who put this incredible event on today. We're expecting around 15,000 people, and as I say, we are the only state on the east coast of Australia that can actually put an event like this on, and it's thanks to Queenslanders. So thank you so much for the great work you're doing. Come out and get tested, particularly if you're in south side of Brisbane, Logan area, or the Gold Coast. Come forward and get tested if you have any symptoms whatsoever, and keep coming out and getting vaccinated, and don't forget to take your mask everywhere you go. Thank you.
Minister, just on the mandating the jab, why so late, and now will those health workers, I think there was reports this morning around roughly 13,500 still waiting to get the jab. Will they now jump the line, Minister, or will you be able to do it at work?
They've always been prioritised. We will absolutely make sure they can get vaccinated at work. We have always done that. There's a range of reasons why some people haven't. It may be that they've been on leave. We've got some staff that due to other health reasons or pregnancy, they've been a bit hesitant and they want to wait. We will work through that. Of course, there's conscientious objectors as well. So we've worked closely with the unions about what the alternatives may be, and we will make sure that we've got the health staff we need. I don't think we've been late to the table. In fact, we have the highest vaccination rates across health workforce across the country that I'm aware of, and it was because we were already talking about it that other jurisdictions like New South Wales started to move on this. But we've done such a good job of getting our staff to come out voluntarily to get vaccinated at such high rates, well over 80%, that we're very confident that those small percentages that left will be able to meet that.